The Civil War resulted in the deaths of an astounding number of 620,000 people. It would be natural to assume this was primarily caused by fighting. But that is just a myth.
In reality, 2/3 of the deaths were caused by diseases and infections.
That's right, approximately 400,000 soldiers died from diseases alone.
Wow, that sure was a lot of people. But why did so many people die from diseases?
That's a great question. In order to understand exactly what happened, we need to study in depth the different factors that contributed to the numbers. One of the many main reasons why so many died from causes other than fighting was because of the lack of sanitation. Soldiers in camps were already weakened by fierce fighting and meager diet, but poor hygiene added to their vulnerability to diseases such as dysentery, typhoid fever, pneumonia, measles, tuberculosis, etc. Most doctors did not recognize the need for cleanliness and often treated the patients with dirty hands and equipment. This inevitably led to infections that killed the soldiers more often than in battles. Early in the Civil War, medical care was just emerging out of the heroic era of medicine. This phase included blistering, bloodletting, purging, and other similar treatments. The idea was to rebalance the four humors, which included blood, black bile, phlegm, and yellow bile. Many believed excessive or lack of these liquids affected a person's behavior and mood. Of course, these harsh remedies rarely brought positive results. They usually hurt the patient rather than heal. Those who successfully recovered owed more to luck than the treatments at that time. A decent hospitalization system was initially and virtually non-existent. During battles, the wounded and sick soldiers were rushed to disorganized makeshift hospitals. These places were often overcrowded. For example, the Fairfax Seminary, which was located in Virginia, only had 14 medical students, but they still had to care for an overwhelming number of 1,700 men during the course of the war. Walt Whitman, a prominent American poet, described the early division hospitals as William A. Hammond was appointed as the Surgeon General of the Army of West Virginia on April 25, 1862. During his tenure, he made several reforms which included an efficient system of requiring hospital records and report which slowed body practices. He also designed organized and standardized hospital layouts and inspection systems. Hammond's clean, well-ventilated, and large pavilion-style hospitals allowed soldiers to receive effective and more sanitary care. During the later years of the war, these hospitals had a previously unheard of 8% mortality rate for patients. In battles, it was unfortunately not unusual for wounded soldiers to remain on the battlefield for over 3 days before anyone took them to the nearby hospitals. Little attention was paid to ambulances in armies. These tasks were given to unreliable personnel such as normal civilians or musicians. Sometimes individual soldiers would aid their fallen comrades, but reduced fighting effectiveness by stepping out of line. Dr. Jonathan Letterman served as the medical director of the Union Army of the Potomac from July 1862 to the end of 1863. During his year-and-a-half tenure, he realized changes needed to be made. Therefore, he proposed the Letterman Plan, which formed an ambulance corps. Union General McClellan issued General Orders No. 147 on August 2, 1862, which officially created the ambulance corps for the Army of the Potomac. The general outline of the Letterman Plan for the ambulance corps included the assignment of ambulances evenly throughout the Army, gives full control of Army's ambulances to officers of the ambulance corps, makes ambulance officers directly answerable to medical directors of the Corps and Army, staffs ambulances with trained and dedicated enlisted men to act as drivers and stretcher bearers, forbids the use of ambulances to carry personal baggage or other non-medical uses, forbids the removal and transportation of wounded and sick by anyone not belonging to the ambulance corps. The Letterman Plan also put the triage system into use. The wounded were treated and evacuated in order of priority, which included 3 tiers. The first priority were the most serious but survivable wounds. The second was less serious wounds. Likely fatal wounds such as in the head or abdomen were last priority. Dressers were the staff who prioritized the wounded and prepared them for surgery if necessary. The Letterman Plan played an especially important role in the Battle of Antietam and the Battle of Gettysburg. If there was no ambulance corps, perhaps the bloodiest day of the war and the bloodiest battle of the war would have a much higher amount of casualties than they already caused. Contrary to popular belief, patients were given anesthesia such as chloroform during surgical procedures. The misconception was probably from the fact that some of the patients were not fully unconscious but was numb to the pain. Others were not conscious of what was going on around them, but their bodies still reacted. Another misunderstanding was about amputations. Many thought of it as an overused procedure, but amputations actually lower the chance of a fatal infection. The chance of dying during amputations was surprisingly low, but because the procedures were not done antiseptically, many amputees still became infected. 3/4 of the medical procedures were amputations. They were done by quickly cutting off the limb in a circular cut sawing motion in order to prevent patients from dying of shock and pain. Surgeons left amputations to heal by granulation, which was a natural process in which new capillaries and thick tissue formed to protect the wound. Some might cut skin flaps in the shape of a fish's mouth to form a stump. A typical amputation kit might have included a trephine, a variety of knives, an amputation saw, bone nippers, a tourniquet, tweezers, scissors, and a hay saw. Nearly all wounds became infected. The reason being was surgeons probed with their fingers to stop external bleeding in cases of chest and abdominal wounds. They usually did not wash their hands, which made them filled with bacteria. Death within 3 days from hemorrhaging or infection was a common result. Surgical fevers included tetanus, erysipelas, and septicemia. Although medical knowledge in the United States during the Civil War was still in its primitive stages, there were a few effective drugs that would be used in the modern era as well. For example, quinine was administered to treat malaria as it is today. Another drug was morphine. Although it was dangerous if abused, it still treated moderate to severe pain. This was usually administered when medical personnel treated a person on the field. Other commonly used medicines were opium, various emetics, iodine, and calomel. Calomel was mercury chloride, and the human body cannot intake much amount of mercury, so this medicine usually poisoned the consumer instead. The lack of preventive measures and specific therapy to treat various diseases became a major factor in the outcomes of some battles and sometimes entire campaigns. During the Civil War, women were not allowed to join and fight in the army, but they found other ways to support their respective sides. Many became nurses and cared for the wounded soldiers. A prominent female figure for the Union was Clara Barton. Especially during the Battle of Antietam and the Battle of Gettysburg, she provided crucial medical supplies to the surgeons and tended to the needs of the wounded and dying. Throughout the whole war, she coordinated the supplies, started relief hospitals, and was placed in charge of diet and nutrition in these hospitals. For these accomplishments, she was dubbed the Angel of the Battlefield by many people. In the Confederacy, there was Sally Louisa Tompkins, who was believed to be the only woman to be officially commissioned into the Confederate Army as a captain. She maintained the Robertson Hospital in Richmond and was well known for her high success rates. The American Civil War was a war that resulted in the most casualties known in history, but that was mainly because the deaths were caused by diseases and infections. The aftermath was that American medical practitioners became pressured to change their theories during this time. Hammond created effective hospitals and Letterman introduced an organized ambulance corps as well as a crude triage system. Although there would definitely be some changes, the triage system would continue on into the modern medical field. Clara Barton would be the founder of the American Red Cross after this war. The Civil War, in a way, sort of sped up the process of furthering America's medicine and into what it is today.